In this last video, we're going to look at ventilation, and we're going to look at the musculoskeletal components that are involved in getting air from the environment into the body where respiration can occur. And respiration happens in the lungs, and it's a process of getting air through the nose, down the larynx, into the bronchi, and then into the alveoli to do with the gas exchange. And that in itself is an involved physiological process, which is outside the scope of what we're looking at here. What we're looking at is the axial skeleton. This is what we've been doing, looking at jaw, cervical spine, thoracic spine, lumbar spine, and looking at the rib cage in terms of the function or the impact that it has on this respiration process. So just recall from the thoracic spine, we have the true ribs, the first 6 ribs, then you have the false ribs, and this concept of the rib cage, when you look at the contents of the thoracic cavity, you have the heart that is contained here, and you have the 2 lungs. This process of air coming in isn't driven by the respiratory system itself. It's actually driven by the diaphragm and the musculoskeletal system. And the process at which this is generating, or what it's doing, it's looking at this differential in pressures. So when you have an increased volume, you're going to create a decrease in pressure, which is going to create a vacuum of sucking air into that container. And then as you decrease the pressure, as the cavity gets smaller, you're going to pressurize the area, and it's going to force air out of its weakest link. And the way this looks like in the body is when you have the chest cavity, you're changing the volume of these cavities based on the space. And you have the only opening is through the nose, the trachea, the air conducting parts of the respiratory system. And this is driven 75% or so by the diaphragm. And as you can see, the diaphragm flattens out. As this flattens out, this plunger here draws down, sucking air in through the conducting areas. And then when the diaphragm relaxes, it pushes things back up and expels air out of that. So the respiration of gas exchange is a passive process. The exhalation is a passive process, and the only active process of bringing air into the lungs is driven by changing the size of the thoracic cavity. And we look first, our first muscle, this is primarily driven by the diaphragm. So the diaphragm is this sheet-like muscle that's at the bottom of the thoracic cavity, at the top of the abdominal cavity, and it's a dome, it's a bowl, and you can kind of see here, looking at an inferior view, that it peaks up and it connects all around, so a 360-degree attachment, a couple openings here for some of the blood vessels, the esophagus, and you can see here how far down this comes. The next image here, you can see like the force angles, the arrows that are there. And again, this is a review from some of the musculature from the respiration video and from the thoracic spine. Just think of this diaphragm as a bowl upside down, and as it contracts, it flattens down. It goes from the starting position here to its contracted position here and then relax. And that depth that it's gaining is creating a negative pressure, kind of like a bellows. So this opens up. As this space gets bigger, it's going to suck air in through the opening here. And then as it relaxes, the elastic recoil of the thoracic spine and the musculature pushes air out of that. So if we look at an inferior and frontal view, you'll see that the diaphragm in its relaxed state, and then as it contracts, it flattens out, and so the diameters and the width gets bigger. So you're going from a relaxed, contract, relaxed, and contract. And you can kind of see in this image here, the starting position, you can see that the size differential is happening. So maybe like it's going from 25 centimeters at a rested position to 28 centimeters in a contracted position, but that's enough to change the overall volume. And you can see here the width, the diameter of this, the footprint of that rib cage is getting larger, smaller, larger, smaller, contracting, relaxing. And in this next image here, we kind of show the animation. You're looking kind of like at a quasi-inferior view. You can see that as that, now the diaphragm is relaxing, and now it's contracting as it's expanding, and it's going through this cycle of contract and relax. So the rib cage expansion is part of this increased volume, and you have the diaphragm at work taking on much of that. So that the diaphragm is about 75% of the expansion. The other 25% of the expansion is this rib movement that's occurring, and you're going from a bucket handle, pump handle aspect. So what's happening is you're getting increase in size in the anterior posterior component and in the medial lateral component. And that's happening at this relationship here between the rib and the vertebra. So the costal transverse joint and the costal vertebral joint, you have movement there, and you can see this like upward movement like a bucket handle, and the sternum's coming forward anterior posterior like a pump handle. And this increases that chest expansion. As we'll talk about, we have different types of breathing, like quiet breathing and active breathing, and the chest expansion is a big part of the active breathing. But you can see the axis of rotation that goes right through here. It spins, kind of rotates up, and this is that bucket handle, whereas as the muscles that are attached to the ribs expand, you get this lateral expansion of the rib cage, and it also has that anterior expansion through the sternum. Again, you can kind of see here the diaphragm contracting down, increasing a huge amount of the volume, and then you can see these force angles of the ribs coming up. So we have a set of muscles that exist between the ribs that help with this elevation and expansion of the rib cage. And so you have the intercostal muscles, and these are muscles that exist between each of the bones, each of the ribs. And we do have this layered effect that occurs in the abdominal region down in the anterior aspect, so looking at like the relationship between internal, external, and transverse abdominis. We also have the same continuation up through the rib cage, and the ribs offer structural support. They're levers through the thoracic spine, and you have these three layers. You have an external layer for that, it makes up the external intercostal, and then you have two internal intercostals. You have a intermediate muscle, and then you have an innermost aspect. And when we look at the next slide here, you can see that the external intercostal goes the entire rib cage, whereas the internal intercostal only hits like that lateral posterior component. And again, you can kind of appreciate that the muscle spans each rib, and so each rib is an articulating joint, and you have these two force angles. The external intercostals pull the ribs up, so they're going to be involved in inhalation, whereas the internal intercostals, they pull the ribs down, and so that's going to be dealing with like active or forced expiration. The innermost intercostal muscles, they are working with the external intercostal muscles, so you actually have like a sandwich layer. Your outermost and innermost layers are helping with inspiration, so expanding the rib cage, and your intermediate layer, or what's usually referred to as the general internal intercostal, that's helping with expiration or forced expiration. So you can see the relationship there of the intercostals, how they kind of go around the body, and that diagonal or that oblique angle that pulls the ribs up and out. And then you have the internal intercostals that has that opposite angle that pulls the ribs down and in. You kind of see that here in this image or this video, where you can see this expansion of the rib cage. Like we said, the diaphragm, as it flattens down, it pushes the lower ribs out. And then the intercostals, particularly external, they're working on the upper rib cage, helping to pull the ribs up and out for that expansion. So you can really appreciate that bucket handle effect here in this image. And then we look at this next image, we'll look at a lateral view, and you can see that anterior translation of that sternum, so that pump handle effect happening in this. And this is again driven by those intercostal muscles. Now you have accessory muscles that are involved in this as well. So you have other muscles that come in, and basically anything that attaches to the rib cage that has a superior origination. So in this case, you're seeing pec minor here, some of the serratus, pec major, depending upon the arm position, that can help lift the chest. You have the scalenes and the sternocleidomastoid at the top here. So again, anything that can pull up on the rib cage is going to help with inspiration. And then as conversely, anything that pulls down on the rib cage, like the abdominals, that's going to help with expiration. When we look at the other muscles that are involved in respiration, most of these muscles we've had before. So we've looked at splenus capitis, we've looked at levator, we've already talked about sternocleidomastoid and the scalenes. We're introducing a couple of new muscles here, particularly the serratus posterior, superior and inferior. And these muscles, you can see, they go from the spinous process and they attach directly to the ribs. We have some other muscles on the anterior aspect. Again, all of these we've seen, and anything that has like an attachment to the rib that has a superior origination will pull up. So pec minor, rhomboid, scalenes, pec major, and then anything below, mostly the abdominal group, is going to be pulling down into expiration. You can see here the serratus posterior, you can see that it has its origination on the spinous process, and it's angled down here to the ribs, that when this guy contracts, it's actually going to pull the ribs up and out, assisting that bucket handle component. So that's going to be involved in that inspiration, bringing air in, and that expansion of the rib cage. You can see serratus posterior inferior, it attaches to the spinous process and comes up to the ribs and will pull the ribs down, similar to the internal intercostal muscles pulling down, working with expiration, similar to how the abdominals are attaching at the lower part and pulling down as well. So same name, serratus posterior, one's superior, one's inferior. They work opposite of each other. This is an image that looks at the mechanics of inspiration versus the mechanics of expiration. You have this quiet breathing, which we'll talk about the difference in the types of breathing here, and you have your forced breathing, which is expiration, and you can see that the abdominals are coming in for this. Now, expiration is typically a passive process. It's usually being done by the passive qualities of the connective tissue, so the elastic recoil that exists within the thoracic cavity. It's only when you're trying to blow up a balloon or project your voice or blow out candles that you have to do forced expiration, where you're trying to accelerate the velocity of the air, or increase the velocity of the air that's coming out of your mouth, and that's going to be assisted by the musculature itself. So when we look at the thoracic cavity, these are all the muscles of ventilation. On the left, you're going to see the muscles of inspiration, and that is primarily driven by the diaphragm. About 75% of the gas intake is coming from that, and then supported by the external intercostals and the internal aspect of the intercostals. And so these are the muscles that are primarily working low force, and this is what's referred to as belly breathing. So you're just trying to bring air in based on the diaphragm with a little bit of expansion of the rib cage. As you start to increase exercise, or you have impairment, or you have shortness of breath, your body's going to rely on accessory muscles, and it's going to start taking in from the pec major, pec minor, and all of the other muscles that attach to the rib cage, but primarily the sternocleidomastoid and the scalenes to bring up that sternum, bring up the clavicle and the first rib. So you have quiet breathing, which is done by the primary muscles that you see here from the external intercostals and diaphragm, sometimes referred to as belly breathing. Then you have chest breathing, or accessory or forced inspiration, which is then you're recruiting everyone else, anything that's attached to the muscle rib cage, for you to go from the normal resting belly breathing to the deep breathing that leads to that chest expansion. And if you take a deep breath right now, you'll notice that you go into a thoracic extension. And the reason why you're going into thoracic extension is that as you go into extension, you are trying to increase the thoracic cavity volume. When you look at expiration now, air coming out of the chest cavity, there are no muscles tied to this. This is a passive process. This is based on the passive elastic properties of the rib cage, the lungs, the diaphragm itself. So under normal belly breathing, you're going to be going from the primary muscles, your diaphragm, external intercostals, to no muscle contraction at all. When you go into that forced breathing, or when you're trying to blow things up, that's when you're going to get the internal intercostals. You're going to get all the abdominal muscles that are pulling down, and then the posterior serratus and the supporting muscles that are doing that. So when you look at this chapter and you're studying what's happening here, you're going to be dividing the muscles of inspiration compared to the muscles of expiration and tying those with what's happening in the rib cage and the thoracic column. Your external intercostals, your internal costals, and diaphragm are your go-to muscles. They're always involved. You'll occasionally recruit the SCM and the scalenes and any of the other muscles above, particularly pec minor and importantly pec major. Right? When we look at people that are running events, when a lot of times people want to put their arms up over their heads to help with increased breathing, what's happening is you're moving the attachment of pec major above the clavicle, and now that the whole fiber is one of the largest muscles of the upper body, anteriorly, can help pull the rib cage up and increase breathing. When you look at muscle air coming out, there are no muscles that are involved in expiration during normal quiet breathing. It's not until you get to the forced expiration, where you're trying to force air out at a higher velocity for blowing things out or blowing up a balloon or whatever you're trying to do. So those are the four primary motions that are occurring here in the rib cage, in terms of you have a quiet breathing or belly breathing, and then you have chest or active forced breathing, and so you have sets of muscles, and really only have 3 sets of muscles. So that's it for the muscles of ventilation. Just a quick look at the rib cage movement. We didn't go into as detail in the previous lecture. This video covers all the bases for the muscles that are there.